So yes, so I took a gap year,
Yeah.
and because my parents were from Hong Kong, I had the opportunity to go there in my gap year, and the idea was to. My brother had also taken a gap year, and it was and spent it in Hong Kong, and it was partly to learn more about where my parents had come from and learn and improve my Cantonese, but also to work for a year before I started med school. So um, originally we'd had this favor where I was going to work in the music industry. That fell through. So I ended up working for my aunt, who is a assistant as an assistant merchandiser. So very random, nothing to do with medicine, but good to be working in an office, and then actually ended up also working for a restaurant. And so that helped improve my Chinese. And I was like a takeaway boy and a flyer boy. And then I also did a bit of teaching English on the side.
So a lot of experience that you gained in a year, and I do think as well, throughout life, whatever you do, you always take some good experiences that you can use in other things away from it.
Absolutely, absolutely. What drives me? So I guess I would reframe that as what are my values? That is how I interpreted that question. And so for me, my values are around growth. So from all the experiences that I've had in my life, it's always trying to reframe it, no matter whether they're deemed positive or negative, as what have I learned from it?
Yeah.
And I'm always seeking out new opportunities to grow as an individual, and help me with what work I do. And that's part of why I've gone into medicine, because you are always learning, and especially in general practice, because you can never know everything. And then support. So through a lot of my roles, there's a sort of advocacy support area. So I think whether that's in GP, supporting my patients, especially ones who are struggling, whether it's mental health or social aspects or physical health, but also with doctors, especially around their mental health and well-being. I think they're the two big ones. And then the last two would be connection and community. I think a lot of what helps me decide whether I'm going to take on something is whether it helps me connect more, because it's always a good day when I've connected with someone, or in terms of community, I'll always thrive more when I've got those good people around me.
Yeah.
I often seek out those as well. So no one in my family is in medicine, or the extended family or any friends really. The only person that was that inspiration was my GP. So funnily enough, I've come full circle, and I did work experience at my local GP with the GP who'd known me since a baby, and certainly was an inspiration at always being there and going back and seeing them and recognizing that familiar face, and not having to explain your backstory. And so certainly I think that was definitely a subconscious and conscious inspiration.
Yeah. So what was it about them that you thought, I really admire this person? What qualities did they have?
I've never actually had to think about it, but I guess you'd say they were magnanimous, but they were there was a confidence that was probably quite appealing, and the knowledge, the ability to deal with any situation, but also deal with that uncertainty, because my mum had health issues, and he'd obviously helped with the rest of my family dealing with those difficult circumstances. I think it was seeing this person with this autonomy and this ability to help so many people, and I think you know, when you first asked that question, my mind was thinking, oh gosh, you know, people must say some impressive people. But then my mind went to my friends, because actually it is the people that I surround myself with who I could talk about for days about the incredible, you know, Catherine, she's a psychiatrist. She's involved in social prescribing for the Royal College, and you know, she does all of this work for children with mental health. And you know, my friend who's Lydia, who's in digital health, and she's seeking out new ways and innovation that can help healthcare, or the people at UOK Doc, who are, you know, all from different walks of life and all really passionate about focusing on doctors' mental health, or Nirja, who does dancing as well as, you know, helping doctors' well-being, as well as being a fantastic GP. So all of these people. I wouldn't necessarily dole out advice. I think I would step back and ask you some open questions, use a bit of coaching, explore what your reasons were for wanting to do medicine, explore why you've chosen this, what you think it's about, what you're hoping for from a career in medicine. Because to be honest, we can't expect, as I said, a 16, 18-year-old to necessarily know, but to go in with good intentions is what we would hope for, to have an understanding of what to expect. But then otherwise, you know, there's a long path, and you know, I've certainly changed my mind multiple times in terms of what career, and you know, my experience through university was so sort of formative that, you know, you'll be a completely different person who you stepped in from when you come out as a doctor.
Yeah. Would you tell them anything about the negative side of it, or would you wait for them to find out themselves?
I think they need to have a realistic understanding that they will be facing grief and death. But I think they also need to know that there is support and camaraderie and, you know, the best friends you'll ever have to support you, and that it's so important to make those friends during your university years, and, you know, to know that you're not alone, and that, you know, you aren't expected to know everything. And, you know, medicine often attracts those type A perfectionists, those people who are expected to be heroes on the ward and deal with everything by themselves. And it's combating the uni's expectations of what I want from you to get into my university versus what we want in medicine, where we want you to know when to ask for help, because until you're a consultant, you are expected to know to seek support from your senior, and to know when you can't manage things, and to know when you're struggling, who is in your support network. So this ties in with my values. I think when I reflect on what made today a good day, it's always the connection I've made, and more often than not, that is a connection with someone who's having some sort of mental health difficulty, because that's what I'm passionate about. And it's that opportunity for them to tell their story of whatever it may be that they're struggling with, and then being able to hopefully help them. You know, it's particularly enjoyable when they come back and they're like, you know, Dr. Alex, like, you know, this has helped so much, like I'm feeling so much better. You know, I've had people go, why didn't I seek help sooner? And I've been living in a fog for years, and that's fantastic to hear, obviously. So obviously that good news, but it's also just that initial one where they feel like it's hopeless, and just being able to tell them that it can get better.
Yeah. I've obviously seen from your own from your own social media that you're a great big fan of mental health services, and so yeah, would not surprised to hear that as your answer at all. What do you dislike the most?
Sure. My mind went to workload transfer. So it becomes a bit political per se, or it's difficult. So I work in primary care, I work in general practice, and that workload transfer can come from another colleague or a senior, or admin staff, or secondary care, so the hospitals. And so I should probably correct it and say inappropriate workload transfer, where sometimes a letter will say, we had a telephone consult with X, and we weren't able to see them in clinic. We've decided they should be on this medication. Please sort this, and this, and do this, and this, and then call them back in a week to check that this, and this. And that's in my lunch break that I'm dealing with that. And so, that's additional workload that isn't necessarily something that should be managed in primary care, because it's not appropriate for the patient that I'm explaining something by a specialist. And then there are things where, it might be, but actually that I have to step back and reflect on, is it appropriate because they weren't able to explain, and I say I dislike it because immediately you tense, immediately everything about you gets defensive, and you have to relax. So say, for example, if it was a colleague that had booked in a patient and they're not working today, so they've booked in for the patient to come to see me, was that appropriate? Or was that sort of, do you get defensive about work shirking, but actually there was a reason, because actually it was more urgent and they needed to be seen today. And so you have to be present in knowing when your body is having those physical symptoms, and then actually being compassionate about, well, what was going on in that situation. Actually, they weren't able to see, or they were incredibly busy. And this is why communication between doctors and all NHS staff and everyone and patients, it's about that understanding. It's about expectations and managing those expectations and making sure that we're all on the same page, because we are all trying to help each other and the patients. And I think certain parts of the NHS system have made it so that we're fighting each other, trying to be divisive, because when you divide, you conquer. And actually, I hear from my more experienced colleagues that back in the day, you used to be able to call the consultant and you had better relationships with other parts of the healthcare. And we want to bring that back. And perhaps it will, but there's constant new systems in place that sometimes add those extra barriers.
It become an unwieldy beast almost,
Absolutely.
So there's a lot to be said for when they had community doctors and community hospitals, and
absolutely, exactly. It doesn't leave a patient adrift, and there was much better collaboration. That's what I want to focus on in the future, and how we do that together without it being a chop and change every 5 years, with every new government trying to prove something in the media without actually providing the appropriate funding or explanation and the time to actually prepare.
Yeah, and then wrapping the same policies and approach differently and pretending it's something new. I've watched this for 30 years and it's the same thing every time, and but we're doing it different, and you think you're really not doing it any differently.
Absolutely.
You're causing a lot of change, putting in a lot of new structures, new policies, and everything else, no funding to go with that, and the outcomes are exactly the same every time.
Yes,
so exactly. Yeah, there's a lot of wasted time, a lot of wasted money doing that. Yeah,
so much.
Definitely.
I actually started I qualified as a GP just before the start of the pandemic. So actually only Jan 2020. And I'm in the same practice that I was in a year and a half before that, preceding that. So there was continuation with the patients I was looking after and the team around me. But obviously, I came into the official position, and then there was this massive change over the weekend. You know, GPs, suddenly need to, consult with patients in a completely different way. But I'm grateful for the silver lining that it almost felt therefore like everyone was starting their job new together with me. And that's an experience that, not many other newly qualified GPs get, where everything was new and we were having daily meetings about how do we deal with this? How do we prepare for this? How do we change our surgery to be safe for this? And so the job has come a long way because, we're fortunate that as small entities, we're able to be a lot more flexible and adaptable. And so the way that we help our patients now is completely different, because back in training, it was, you see every single patient and they have to take time off work and they have to, take the kids out of school, and everything is a face-to-face, or most things were, unless it was like a medication request. And so the big change for us, obviously, is that then it went to full telephone or video, and bringing in patients required dressing up in PPE if we had it, and seeing patients in the hot clinic. And now it's gone back pretty much to face-to-face, a bit hybrid, but it does provide that convenience of not taking someone out of school or work for telephone. And so sometimes it's easier for both the clinician and the patient. There are things where we now have like text messaging services, so I'm able to send directly like information leaflets, and our scripts are all digital, and we can just say, oh, go and pick them up from the pharmacy, or if you've got COVID symptoms, like the pharmacy will deliver it. You don't need to come and pick up that paper script. And there's been a lot of innovation from that perspective. And so again, a silver lining, it was something that had been coming up. It was due to come into effect by April 2020 anyway, but it was kind of enforced and much more rapid integration than there was perhaps in hospitals for those clinics. But it has had an effect, obviously, and we've seen that sort of blown up in the media. And it is unfortunate that the message wasn't clearer for patients, because we were open and was working every day and we were seeing patients. And I understand that some practices had different policies. There wasn't always clear guidance from NHS England around how practices were meant to protect their staff and the other patients in the waiting room, or if waiting rooms were closed. And people thought they were protecting the NHS by not coming in or not calling their GP or delaying things. And so now it's kind of a catch up, but we are also struggling because we've got less staff, both clinicians, but also the real front line for us is the people on reception who, we're starting to expect daily abuse. And so they don't want to work in a job where they think they're going to pick up a phone and just get shouted at.
No. And the demand for your services has gone through the roof at this point.
Absolutely. That's the crazy thing, for all of the propaganda, we are providing more appointments than the year before, than pre-pandemic, and with less workforce. And, everyone is coming in now and they're like, whilst I'm here, can you look at this? Oh, I didn't see a doctor for 2 years, or I didn't call up, or I couldn't get an appointment. And it's like, we were here, and I appreciate that, but it's just having a compound effect. And a lot of my colleagues are struggling because we have also gone through the pandemic with you.
Yeah,
and
absolutely.
A lot are exhausted, and then the government is pushing through new structural development changes, massive development changes, that at a time where everyone is almost too exhausted to contemplate or to consider the long-term consequences of it. And so it's kind of steamrolling through, because you're at your weakest point to be able to put up an argument or a fight.
Yeah, and on top of delivering the 3 rounds of the COVID vaccinations, you're also picking up all the slack from hospital waiting lists, where they're not having operations and things, and still those conditions need to be managed. So where do you go? You go to your GP, so, and I don't think, with the whole GP bashing thing going on in the media, there was a very fair storyline of what the reality was for GPs. And of course, you're all exhausted on top of that as well. And actually the whole virtual, being able to have appointments virtually, it's almost like you never get a break. You're always accessible. It's just, it's been a tough old time, really has, with no sign of it abating, So yeah, hats off to you for. Thanks.
And also to all my colleagues, both in primary and secondary care, I just want to say, obviously, we are all in this together, and really that's why it's looking upwards that we need to say, actually, give us a reprieve, give us time to recover before you introduce new legislation, before you introduce new bills and new systems and structures, because we have all been through something that's generally incredibly traumatic, and we have turned up the gears to be able to deal with it, but the expectation is you continue at that same speed, and that's what's unsafe. And we just want our patients and our public to just question why there is this sustained attack, because we've seen already now the patient satisfaction, which has been so high, the trust in our doctors has been the highest it has for a long time, and that has seen I think like a 30% drop since this media campaign against us. And that's devastating for us, because actually that trust and rapport means so much to us, because that's what's helped with sort of the COVID vaccine uptake. That helps when they are concerned about talking to us about their mental health or this mole, and feeling like they can come to us, and we don't want that to be demolished because of this tainted opinion that's been created.
I sadly I do think that it's the political will and the political agenda to defund you. It's the whole Jeremy Hunt blueprint of, we won't go into that, but
Which one?
So you top 3 then. Okay.
So there's the 3, but workforce crisis. So we need more staff. The workload crisis. We need it to be a manageable workload. And then funding, we need appropriate funding. So those are the 3 top-down systemic changes that need to be appreciated, which the health secretaries are well aware of, and and the Health Select Committee, you know, headed by Jeremy Hunt, who is responsible for the 2013 junior doctors strikes for the first time in 40 years, which led to a large outflow of junior doctors from the workforce, and you know, an effect on patient safety, who is now asking the question, why are we struggling to retain doctors and struggling to recruit? You know,
you would have thought, though, you know, given that there is such a shortage of nurses, of doctors, and there's such a almost been a mass exodus over the past few years, the whole supply and demand would suggest that you're in a strong position to do something about it, more than ever in a strong position. And I totally get that the whole, we wouldn't put our patients at risk, but it's that very, your values and your ethos that are being taken advantage of by people. They know you won't do that, so they can keep adding a straw to the camel's back, and it keeps taking the load, you know. And at what point do you say enough is enough? We just cannot do this anymore.
And certainly that requires a strong organization to rally that community, because the problem is that it's not necessarily us as a whole that do it requires us as a whole to make that decision, and legislation has made it so that it's a certain percentage that need to agree to that. But instead what we're seeing is individuals making that decision for themselves. Yes. And so you're getting lots and lots of individuals going, actually, I've had enough. Actually, this isn't right for me. Actually, I'm not appreciated at work. Actually, I'm just a cog in a large system. I'm not valued. I'm not appreciated. I did those extra night shifts and now they're just asking me to do more. You know, I do that overtime, you know, out of my goodwill. And now I've crashed my car and they don't care and they expect me to get to work, you know. And these are the nurses and the HCAs and the doctors and everywhere and in between, who are just making these decisions to go, actually, for all of the positives, I can't afford to continue to do this. And that's what's a real shame. And that's why there are individual factors and there are systemic factors, and we can't always control the systemic factors. And so it has to be on the team in the middle that is responsible for ensuring that boundaries are put in place and that their staff are protected and that they don't become divisive, and that we ensure that we're looking out for each other, because, you know, it's so easy to get lost in the NHS. You know, it's the largest employer, second largest, and that's part of the joy, you know, actually coming to work and seeing the people. And that's why it can't just be a turn up to work, card in, do your work, card out, because there's so much more to it. But also we do it for our patients, but it isn't about altruism. You know, the fact that nurses were using food banks is ridiculous.
Scandalous.
You know?
Absolutely scandalous. Yeah.
The fact that MPs continue to get pay rise after pay rise and free car parking, and they're taking away free parking for NHS staff. So you go to work and there's no
work.
Yeah, and you're paying to work, exactly.
Yeah. And on top of all the other, you know, the insurances you've got to pay for and everything. Yeah, it's absolutely scandalous. It really is. Yeah. And I suppose that's kind of partly the same as if you were in charge, what would be the top 3 things you would change? What would make the biggest difference for you?
So I mentioned before, of course, if I was in charge, appropriate banding for NHS staff, right? Because that's it. It is not about money, but it is about valuing the staff appropriately so that they are not struggling, so that we retain good staff, so that the money is going towards the people on the front line who are, you know, putting their health at risk. And whether that's, you know, the fact that death rates are increased in people that work night shifts, and, you know, there's always going to be someone that mans the hospitals, you know. But the other things behind it that we've learned and that have started to be integrated, that I've asked for from Westminster, are that we integrate sort of support services into hospitals and trusts and boroughs and CCGs, so that there is paid time to be able to deal with the death of a patient and grieving, not just, oh, stay on an extra hour to debrief about that resus or about this patient, but actually quality time, as you would for other difficult jobs, where you actually get to reflect on and grow as a clinician or healthcare professional. We need to embed all of this training and support into medical students, because they need to be able to know what's going to happen when you face a difficult scenario, when you're faced with racism in the workplace, or bullying, or you know, a patient has treated you inappropriately, or unfortunately, like a relative is screaming in your face, and actually they're scared and they're frustrated. And how are you going to deal with that on your own at 3 a.m. in the morning? And are you prepared? Do you know where to go to seek support? Is that support available? And is it fully funded? So that we are prepared. And then I think just basics, you know, basic staff welfare needs to come in way before well-being, because we need hot food, we need a space to rest on a night shift, we need, you know, appropriate estates and buildings to house GPs. You know, it shouldn't be in a dilapidated, you know, old home. And we need to be able to, you know, have access to free car parking and all of these basics that in any other business you would never treat your staff this way and be like, you know, you're not allowed to drink on the ward and it looks unprofessional. And, you know, again, it's that divisiveness between teams, because for NHS staff, you're constantly rotating, so you constantly feel like a newcomer. And actually we need to have these organizational changes embedded, because otherwise there's not enough time for each new person to suggest something, and then it's not sustainable.
Yeah, definitely. I think the basics are lacking. And when you look at your counterparts in different countries, it must feel like, oh my goodness, we are so the poor relation here. Really terrible.
The last 2 years have obviously been incredibly difficult, but with the pandemic, there's been a spotlight shone on the well-being of healthcare professionals. So I think it's been fantastic for me to see that support being enforced, and for people to actually be reflecting on how we treat our staff, and actually, you know, we don't want it to be a management tick box, but we are appreciative that people are now listening to us when we say, you know, this is what's required to show increased retention. This is how we should have been treating our staff to begin with. You know, don't just take them for granted. There's a lot of goodwill given by NHS staff. And, you know, for the way I work, actually, it's meant that we have been able to build UOKDoc, the charity, or the Workwell Doctors as an organization. And it's meant that people have sat up now and listened and taken heed of the advice that we've given and some of the suggestions of how their workplace can change, because otherwise I think it was in a bit of a rut, and it was like, yes, well, later. And now people are understanding that the change needs to come now.